Hello, future nurses. Today, we're diving into a fundamental concept for patient care: acid-base balance. Think of your body as an orchestra. Every part must work in harmony, and pH is the conductor. Even a slight imbalance can trigger serious problems, so nurses must recognize and respond quickly. Mastering acid-base balance isn't just for exams. It's about understanding your patient's physiology and being their vigilant advocate. We'll break down metabolic alkalosis into simple, manageable pieces, so you feel confident in real clinical settings. This knowledge is a vital tool you'll use throughout your career. Take a deep breath. Let's explore what happens when the body's pH shifts too far to the alkaline side. We'll cover why it happens, what it looks like, and what you can do about it. Let's begin this important journey into metabolic alkalosis. What exactly is metabolic alkalosis? Let's break it down. Metabolic means the problem starts with the body's metabolism, mainly the kidneys and bicarbonate. Alkalosis means the blood is too basic, with a pH above 7.45. In simple terms, metabolic alkalosis is when there's too much bicarbonate or too little acid in the blood. Imagine making lemonade. Too much sugar, bicarbonate, or not enough lemon, acid, makes it undrinkable. The kidneys usually control this balance, but sometimes they can't keep up. The body tries to compensate by slowing breathing, retaining carbon dioxide to bring pH back down. As a nurse, look for high pH and high bicarbonate in lab results. These are your classic signs of metabolic alkalosis. Understanding this mechanism is the foundation for connecting labs to patient care. It's the first step in reading the story your patient's body is telling you. Now, what causes metabolic alkalosis? The most common cause is loss of stomach acid. Think severe vomiting or NG suction. Diuretics like furosemide or thiazides can also trigger it by causing the kidneys to reabsorb more bicarbonate. Overuse of antacids or receiving large blood transfusions can add too much base. Endocrine disorders like Conn's or Cushing's syndrome can also lead to this imbalance by causing the kidneys to lose acid. Recognizing these causes helps you identify at-risk patients. Your awareness is key to early intervention. Always connect the dots between patient history, medications, and symptoms. Metabolic alkalosis affects multiple body systems. Your assessment skills are crucial. GI symptoms may include ongoing nausea, vomiting, or even paralytic ileus. Neuromuscular signs: tingling, numbness, muscle cramps, or twitching, sometimes even tetany. Watch for Chvostek's sign: facial twitching when tapping the cheek. Cardiac effects: fast heart rate, irregular rhythms, and dangerous EKG changes due to low potassium. Respiratory compensation: slower, shallow breathing as the body tries to retain acid. Neurological changes: dizziness, confusion, or even seizures in severe cases. Recognizing these clues early can prevent serious complications. Your keen observation makes all the difference. As a nurse, you're on the front lines of managing metabolic alkalosis. Monitor vital signs, especially breathing and heart rhythm. Use a cardiac monitor if needed. Track intake and output to assess fluid and electrolyte losses. Address the cause. Adjust NG suction, review diuretic use, or manage antacid intake. Replace fluids and electrolytes. Normal saline and potassium are common treatments. Administer potassium carefully. Never IV push, always dilute and infuse slowly. Implement fall precautions and educate patients and families about symptoms and treatments. Your proactive care ensures patient safety and recovery. Metabolic alkalosis isn't just an exam topic. It's about real patient safety. Imagine an elderly patient with an NG tube who becomes confused and twitchy. A nurse who understands acid-base balance will spot these as red flags, not just post-op changes. You'll connect the loss of stomach acid to the symptoms and act quickly. This knowledge transforms you from a task doer to a critical thinker. You'll anticipate problems, monitor high-risk patients, and intervene before crises develop. Early recognition and action can prevent complications and save lives. Always frame what you learn in the context of real people and stories. Mastering this material prepares you to provide excellent, compassionate care. That's the true reward of your nursing education. As we wrap up, remember, mastering metabolic alkalosis is just one step in your lifelong nursing journey. Every nurse has faced these challenges and grown from them. Nursing is a profession of constant learning and adapting. Each patient and every new experience will deepen your understanding. Don't be afraid to ask questions or seek guidance from mentors. Build your foundation strong. Concepts like acid-base balance are essential. Stay curious, keep connecting classroom knowledge to real-life care. You're preparing for a career that's demanding, rewarding, and profoundly meaningful. We're proud to welcome you to the nursing profession. If you enjoyed this content, please like and subscribe to NurseEdScholar.